This is a medical, educative and informative video on the radiofrequency ablation treatment for trigeminal neuralgia. Trigeminal neuralgia is one of the commonest reasons for the facial pain syndrome. Here the patient experiences very intense, excruciating electric shock-like pain sensation over the one half of the face, either in the forehead or in the cheek area or in the mandible region, or one or more of these places. Here the treatment option would include medical line of therapy, surgical options like microvascular decompression, radiosurgery or radiofrequency ablation. Here we demonstrate the radiofrequency ablation treatment mode for the trigeminal neuralgia. This patient, 75-year-old, presented to us with a history of having severe pain in the right half of the face over the mandible and the cheek area, excruciating, lancinating type of pain which has lasted for about last 5 years. Initially used to respond with medication, but in the last 6 months his pain is continuous, not responding to the medical line of therapy, and worsens on speaking, eating or even washing the face with the water. And patient did not want to undergo a major surgical intervention, and he also had comorbidities like hypertension and diabetes. Hence we decided to go ahead with the radiofrequency ablation of his trigeminal nerve on the right side. Radiofrequency ablation is a well-established, minimally invasive surgical procedure well suited for people who are not well responding to medical line of therapy, elderly patients and the patients who are contraindicated to undergo microvascular decompression. The patient is taken to the operation theatre, made him lie down supine with a slight neck extension. A point is marked 2.5 cm lateral to the angle of the mouth on the affected side. Local anesthesia is infiltrated and the needle is inserted in the direction of the mid-pupillary point and the 3 cm medial to the external auditory meatus. The needle is advanced further and entered the foramen of oval. This entering of the needle to the foramen of oval is confirmed either by C-arm or through the CT scan images. In this video, we are demonstrating the confirmation done through the CT scan. Patient is shifted to the CT scan room and the CT brain was performed and the bony windows are evaluated and confirmed that the needle is at the foramen of oval. After confirming the position of the needle, the stellate is removed from the needle and then the lesioning electrode is introduced into the needle. The electrode is connected to the radiofrequency generator. Initially, 0.2 MHz current is stimulated to ensure that only the sensory component is involved and motor is spared. Once that is confirmed, the generator is set to the temperature of 60 degrees and the time for 60 seconds. Once this is set, then the lesioning is started. During this time of lesioning, the patient is continuously monitored. Once the 60 seconds is completed, the lesioning is stopped. The needle is removed and the patient is assessed. This particular patient did not have any complication and he is completely relieved of his symptoms. Post procedure patient status.
ಅನುರಾಧ ಎಸ್ ಕಬಾಡಿ. ಇವರು ನಮ್ಮ ತಂದೆಯವರು ಶ್ಯಾಮ್ ಸುಂದರ್ ಸರ್ ಕಬಾಡಿ ಅಂತ ಹೇಳಿ. ಇವ್ರಿಗೆ ಟ್ರೈಜೆಮಿನಲ್ ನ್ಯೂರಾಲಜಿಯಾ ಅಂತ ಹೇಳಿ ಪ್ರಾಬ್ಲಮ್ ಇದೆ, ಅದು ಸಫರ್ ಆಗ್ತಾ ಇದ್ರು. ಇಲ್ಲೇ ಕ್ರಾಂತಿ ಕಿರಣ್ ಡಾಕ್ಟರ್ ಅವರು ಇವರಿಗೆ ಒಂದು ರೇಡಿಯೋ ಫ್ರೀಕ್ವೆನ್ಸಿ, ಅದು ಶಾಕ್ ಟ್ರೀಟ್ಮೆಂಟ್, ಎಲೆಕ್ಟ್ರಿಕ್ ಶಾಕ್ ಟ್ರೀಟ್ಮೆಂಟ್ ಕೊಟ್ಟಿದ್ದಾರೆ. ಈಗ ಸ್ವಲ್ಪ ಗುಣ ಆಗಿದೆ. ಮೊದಲಿಂದ ಮಾತಾಡ್ತಾ ಇರಲಿಲ್ಲ, ಈಗ ಸ್ವಲ್ಪ ಚೆನ್ನಾಗಿ ಮಾತಾಡ್ತಾ ಇದ್ದಾರೆ. ಅಷ್ಟು ಕ್ಯೂರ್ ಆಗಿ ಚೆನ್ನಾಗಿ ಕ್ಯೂರ್.
ಶ್ಯಾಮ್ ಸುಂದರ್ ಕಬಾಳಿ, ನನಗೆ 76 ವಯಸ್ಸು. ಮತ್ತು ನನಗೆ ಇಲ್ಲೇ ಎಲ್ಲ ಸ್ಪಾರ್ಕ್ಲಿಂಗ್ ಆಗ್ತಿತ್ತು. ಅದೆಲ್ಲ ಪೂರ್ತಿ ಭಾಳ ವರ್ಷದಿಂದ ಇತ್ತದು. ಈಗ ಇಲ್ಲಿ ಬಂದು ತೋರ್ಸಾಕತ್ತೀನಿ. ಒಂದು 1 ತಿಂಗಳು 2 ತಿಂಗಳದೊಳಗೆ ಗುಣ ಆಗೈತಿ. RFL ಲಿವರ್ ಆಪರೇಷನ್. ಈಗ ಆರಾಮಾಗಿದ್ದೇನೆ.
This patient had a complete relief of his symptom following the procedure. Radiofrequency ablation is one of the good modality of treatment for trigeminal neuralgia. We thank the patient for the consent.